So teknik ni kita panggil apa yang tanam?
Right. So hair transplant ni dia ada dua teknik.
Okay.
Satu kita panggil FUT, satu FUE. So the technique ni is mainly how you harvest the hair, not how you put it in. The difference is always how you harvest. Harvest can be FUT, FUE. FUE is the one of the latest technique where you can take one by one hair.
Okay, FUE.
FUE dia panggil follicular unit extraction. That means you ambil one. So dia ambil satu dia guna special machine.
Okay.
FUT, you cut a strip. So you cut macam scalp tu, cut panjang. Cut a strip. So when you cut a strip, and then you jahit balik satu line belakang tu, hair ni your assistant akan cut slice one by one. So the disadvantage of FUT or the follicular unit transplantation is the scar behind lah. So there is a long scar.
Okay.
So the FUE, you tak ada scar lah because you ambil satu-satu dia heal by itself.
Extract.
But there's still a role of FUT compared to FUE. Memang still a role. Macam orang yang tak ada rambut sangat, you have to go for FUT. But mainly, if you can, you go for FUE lah. Elsewhere, even in Turkey, Korea, US, UK and all that, the shift is now doing FUE. We do both lah.
Okay, so you depending pada situation mana yang memerlukan.
Correct, but mainly is nowadays is FUE because healing is very fast. So that within 2 weeks so dah okay. I got a lot of my client pun, a lot of doctors, a lot of them actually consult the medical doctor. So they do that. The next week tu they already went back to ward, doing ward rounds and all that. Cuma kena pakai cover lah. Ada pakai kepiah, ada yang pakai hoodie, ada yang pakai beanie. Kalau the surgeon tu dia pakai the surgical cap lah.
I see.
But it's okay. I mean,
so healing process lepas dah tanam tu about how long?
Usually kalau the donor side tu dalam 2 weeks tu the hair will grow back. 2 to 3 weeks tu dia akan grow back macam usual. Almost 70-80% of normal hair will grow back behind. So tak nampak pun yang you ambil tu. That's the advantage of the FUE technique.
FUE. So preferably kalau boleh FUE lah sebab healing process is lebih cepat.
Tapi dia punya learning curve is more steep. Maknanya you need to know how to, it's not as simple as just ambilnya tu. Kalau you silap ambil, dia putus. Rambut tu dia baby hair, like 2mm. So putus habis tak ada tanam lah. Lepas tu you kena ada cara nak ambil dia gentle. Nak tanam pun ada cara. Kalau you tanam sikit dia crush, habis rosak agak. So the learning curve tu is there lah. But okay,
that is what you like to do. Okay, I dengar macam alright. So interesting. So because when I go through your IG, that's why I came across the FUE dengan
FUT.
Okay, so first time dengar. So baru tahu what is actually the difference between those two.
So it can be used for anywhere, not only the scalp. So we have done on the eyebrow. So there are also cases we do on the mustache and then on the beard. You can do anywhere that you want.
Okay. Soalan yang Eman nak sangat tanya, normally macam you mention FUE just now. So bahagian part mana rambut yang diambil? Kalau contoh selalu kan botak saja, masalah depan dengan
so this is another interesting concept that people have studied. So you see when orang tu botak, macam lelaki for example man, you always notice lepas ni you akan keluar daripada my clinic, you will start to look at people punya scalp. Kalau botak tu will always be in front and the side, it will never be botak belakang. If you notice betul-betul dekat belakang dia panggil occipital scalp tu, there will never be area of loss of hair because and then people study why. Is it coincidence or there is a scientific basis behind all this? Actually there is. You see, remember I told you earlier the receptor that causes the hair loss, it only exists on the upper and front and the side of the scalp. So the receptor is not there on behind the scalp. Why, we do not know. We are made such a way that our scalp is like that. So because of that, the balding process only happens at the front, side and the top for men. And for ladies usually on the top because of this effect.
I see.
So hair behind dia tak ada. So that means you can use the hair from behind to actually put it in front. It will not be subjected to the same process of the hair loss. Because the mechanism and the physiological process is different. So that forms the basis of hair transplant punya science. So because of that, it will carry the genetic punya coding from the way you take. So if you take from behind, it will remain that. So they panggil donor dominant lah. So then the hair will continue to grow. Then people will ask, kalau you take from behind, you put in front, will not be subjected to the hair loss? No. Because dia tak ada reaction to the receptor the same way as the hair in the anterior part. Yeah.
Okay, betul juga. Baru lepas doktor mention baru perasan. Okay, memang nampak lelaki have yang botak tepi, tengah. Perempuan memang selalunya
atas
saja.
Yeah. So men really atas, mana botak tengah tu, mana botak tengah depan. Tak pernah ada orang botak belakang.
Tak ada. Memang kalau botak pun dia botak memang sini memang ada sentiasa ada rambut dekat sini.